Hello, shroomies and creepers. Welcome to another episode of See You on the Other Side. I am your co-host, Christine, and I'm here with Leah. And we have a very special guest today. We have Sunny Strasburg, a psychedelic trauma therapist out of Salt Lake City, right?
Yes, that's correct.
Well, hello. Can you give us a little background of what you do?
Certainly. I am based in Salt Lake City. I'm licensed in Utah and Maryland, but I travel a lot. I do a lot of trainings all over the country. I travel a lot to Costa Rica and do work there. My background is I'm a trauma therapist. I'm a licensed psychotherapist. I've been in private practice for a long time and never thought my world would merge with the psychedelic world. This is really a dream come true. It's so amazing to watch these medicines coming above board and going mainstream. It's incredible. So I have a ketamine clinic in Salt Lake City, and I'm a lead trainer at the Ketamine Training Center. So I help train clinicians, licensed mental health care providers, physicians, nurses, how to use ketamine and other psychedelics. And I'm also the clinical director at a virtual reality company. So it's a pretty wild thing. When I was younger, I was a video game animator. I was an artist before I became a therapist. And
Wow.
yeah, and so it was just this crazy. I mean, it's life's crazy where it merges these things together. But a couple of years ago, I developed an app with my business partner, the composer David Starfire, creating playlists and meditations for people that were going through psychedelic therapy. I was seeing so many people coming to my clinic that were being traumatized by going to ketamine clinics and having zero therapeutic support. And so I'm really about accessibility to psychedelic medicine and proper support. And so David and I developed an app where I was providing meditations and invocations and meditation guidance and therapeutic guidance for people that were going through ketamine treatment. And we were acquired by a company called Trip that creates virtual reality meditation.
I have that app.
It's amazing, isn't it?
We've talked about that app before. Wow.
Oh, it's amazing. Yeah. So now I'm the clinical director of that company, and we're developing products specifically for clinical use. I'm heading up a study right now on the use of PsyAssist, which is our company. Trip PsyAssist is the sub company at Trip. And I'm doing voiceover, writing meditations and doing the voiceover for Trip PsyAssist now. So it's really beautiful to watch all of these things, coming together, dovetailing together.
So in summary, you're a boss ass bitch.
Yeah.
I just had to say it.
Yeah.
I just had to say it because I was thinking it.
Small correction. I'm a boss ass witch.
Oh, now she's speaking to me. I love this. That is so crazy.
So you have that app?
I do have that app. We've talked about that
Small
app
world.
before, and I had no idea. I love that, there's music on there that you can listen to, and different type of vibes, depending on what your intention is when you go into it.
Well, and I saw it on her website and that you were in Forbes, but I didn't really know what PsyAssist was. And I was like, oh, now I know.
Yeah, you just blew our minds. Yeah. Here we are thinking we're just going to talk to a trauma-informed therapist, and we're like, oh.
This is going in a different direction than I thought, but it's in a good way.
Absolutely.
Nice. It's really amazing what virtual reality, how there was just a study that came out a couple of weeks ago about how on the MEQ, which is the mystical questionnaire, virtual reality is comparable to psychedelics. It's very immersive, right? You're in the space, and I'm really curious how we can help reduce anxiety prior to a psychedelic experience by using virtual reality. But the amazing thing about it is you can take it off, right? Once you take ketamine or mushrooms, you're going on a ride, right? You're in it.
You're in it.
But the virtual reality is kind of nice because you can remove it if it's too overwhelming. And so I think it's a way to help us alleviate the anxiety of going into a psychedelic experience and not knowing what to expect, to be able to titrate into the experience, you know, and be in an immersive world, have voice guidance, and kind of get a feel for what that might be like. I have many, many clients that are very psychedelically naive, right? That are coming to me for ketamine treatment. And it's so nice to be able to give them something to say that's kind of like this. You know, it's not exact by any means. You're not getting the same benefits as the psychedelic medicine, but you can kind of, you know, see what the experience is like a little bit.
Wow. Yeah, it's really hard to put into words or describe or even draw some of the things that come up in a psychedelic experience. So that's pretty incredible. I would definitely be interested in looking at that. Like my kids have like Oculus and the virtual reality stuff. So I've already seen like how crazy it can be. And like, you know, you think you're falling when you're not falling. That's cool. So you do a lot of work in Costa Rica. I had no idea that either. I mean, we've been following you for a while, but like your content, like I'm like, there's so much to learn.
Thank you. Yeah, I actually, my family and I lived in Costa Rica for a while. We sold everything, you know, moved our kids down there and lived at near an ayahuasca retreat center. And I did a lot of work helping them integrate, you know, with people that were coming. And then, you know, it's pretty wild to leave, you know, your cubicle and your little day job and go have your mind blown with ayahuasca and then go back to your cubicle and day job in the States, right? And I was really seeing this need to have good integration and you kind of like digesting what's happening to you before you go back to your life. And so I was serving to help people do that, to help integrate before they were returning home. And that was really a powerful affirmation about the importance of the container with psychedelic medicine. You know, I think right now in the States, we're so focused on, you know, that, you know, psychedelics are legal and psychedelic, the pill. And I think we're really pharmacologically oriented to take a magic pill and everything will be okay. Right. And it's really important. I really think it's important to spread the message that, you know, psychedelics are incredible potentiators, but you need set and setting. You need proper preparation. You need proper support during the experience, and you need proper integration coming back. And that experience in Costa Rica was really validating for how important that is for me.
Yeah. And we've interviewed somebody who they were in Costa Rica as well and had retreats with psilocybin. And, you know, they said that they hated it because then people would leave and then go back to the real world.
Yeah.
And he didn't know that they were maybe struggling with certain things. And so then they moved back to Louisville, Kentucky and started a church. So then they could build a community and continue to stay with that community and help people integrate and adjust to, you know, when life hits you.
Yeah.
So
I don't think this is the real world. I think we're in this crazy samsara world in this world. I think the real world is kind of more like the psychedelic space, right? I mean, when you're in nature and you're connected to a community and a tribe, you know, when you're doing these retreats, I think that we're evolved to be together in that way and experience things in that way. I think that this is really the dream world. And, you know, everybody talks about this explosion of anxiety and depression and PTSD. And it's like, I think we need to pull the lens back and look at living in a culture that creates depression, anxiety, and PTSD, right? Like, I think it's time to have these larger conversations about needing to really change the structure of the world that we're creating and participating in, right?
Yeah. And I grew up in a home. We've talked a lot about, we both grew up with abuse. I grew up in a home with alcohol addiction and domestic violence. And a lot of the theme that I had heard from a lot of my family members was, well, alcoholism runs in our family. Depression runs in our family. Anxiety runs in our family. But since doing mushrooms, I'm like, trauma runs in our family. Yeah. Not alcoholism, not depression. They may have used alcohol to escape, but it's trauma. We have so much trauma that no one is dealing with and no one is handling. And I think sometimes when you're first starting the healing journey, my thought would be like, why me? Why do I have to do this? Why do I have to do the healing? And why do I see it very, very differently now, because I see people not working on themselves and healing and escaping things. And I'm the one who's doing that for my children and for my family. So I do want to talk to you a lot about trauma and I saw that on your website, you posted how, we're finding that like depression is not a chemical imbalance.
Yeah.
And tell us a little bit about that and kind of the work that you do being a trauma therapist.
Yeah, I love what you said about, our family it has trauma that runs in the family, because that's exactly true. As you were speaking, I was talking about my first internship after I got out of my master's program in therapy was to work at a drug and alcohol rehab program. And I thought, oh, we're going to be talking about, staying sober and white knuckling it and, all that stuff. And all of our conversations were about trauma. That's the underlayment of all of it. Right.
Right.
That really informed me about the importance of learning how to treat trauma, that was more important than talking about staying sober. So, we want to dissociate. That's when we're in a traumatizing situation, right? We tend toward either wanting to dissociate, have parts of us that want to just check out, or we have parts of us that want to become almost manic and overachieve and overwork. And, so it kind of splits into these two different, ways of dealing with trauma. So, yeah, I think that, I really love Gabor Mate's messaging that, a lot of mental illnesses have the foundation of trauma, right? That exacerbate them. And we're really looking at, things like depression and borderline personality disorder and things like that, not so much as a chemical imbalance, but more as a trauma, a trauma issue. The assessment tool called the ACEs, Adverse Childhood Experiences, has been really incredible to inform us about all kinds of things about how trauma affects us throughout our lives, right? So it's not only mental illnesses, but we see socioeconomic impacts. We see physical disease. A lot of autoimmune disorders now are correlated to higher scores on the Adverse Childhood Experience questionnaire. Bessel van der Kolk speaks really, often to that correlation between physical illness and mental illness and the ACEs. So, yeah, I think it's really important, and we need to talk about how we can support families and create a culture that's more provides more tools in mental health for families that are experiencing trauma, right? Because it's multi-generational, just like you said, Christine.
Yeah, but I think a lot of people don't even realize that they have trauma, because I was someone who didn't go to addiction, but my thing was, I'm going to be really successful and hustle and prove that I'm different and prove that like I'm do this, this, and this, and this, and this. I'm so much better and I'm doing better. But that was also, I realized, a distraction. I still didn't face what I was struggling with. I still suppressed a lot of things. And, oftentimes people think Leah and I were like, they're like, well, you guys were abused. And I'm like, yeah, but you're on antidepressants or anxiety medicine. Why is that? Maybe that's something to look into. But people think, well, I just have anxiety, or, oh, I just have depression because I have a chemical imbalance. So it's kind of interesting.
Yeah. That article that I posted was that, this idea that serotonin, there's a serotonin imbalance is now we're looking at that again and saying, maybe that's not the case. And a lot of the science that SSRIs were based on are being questioned, that's really being questioned now. When they first, my understanding, and I'm not a researcher in this area, but my understanding is that when they were looking at how the SSRIs were affecting mice, they did the studies on mice. mice are prey animals, right? So they'll stay near the edge of the cage when they're in an open area. And when they gave them an SSRI, the mice just stayed in the center of the cage in the open space. And so they made all these assumptions about, well, that means that they're not anxious anymore because they're in the center. And I don't know if that's really, I don't know if you could really say that. So Bessel van der Kolk did a study where for PTSD where he looked at Prozac, EMDR, and placebo. And the placebo and SSRIs had the same effectiveness, and EMDR was much more effective than both. So,
wow.
That.
And you do EMDR, don't you?
I'm certified in EMDR. Yeah. EMDR is really amazing. And one of the talks that I gave, I looked at all the studies I could find on what's upregulated and downregulated in the brain during EMDR on a functional MRI or SPECT scan, and compared that to what is upregulated and downregulated on a ketamine when a patient is on ketamine, and it's almost parallel. It's really interesting.
Wow.
So the same areas of the brain are upregulated and downregulated with EMDR and ketamine. And I use, when I work with ketamine with my patients, as they're coming out of the ketamine experience, I will sometimes weave EMDR into the therapy, and it's super effective. And that's what really piqued my curiosity. Like, why is this so effective? And I think it's got the symbiotic effect, probably. I mean, I don't think there's been any research done on this yet, but I'm really interested to know if there is some kind of like synergy that happens with those two things. The same with IFS. I mean, I haven't looked at how IFS up or down regulates the brain, but using IFS in combination with ketamine is really, really effective and creates this enduring change,
What is IFS? That's something I've never heard of.
IFS is internal family systems. It's one of the, it's one of the therapies that they use at MAPS in the MDMA training. It's amazing. Yeah. I do trainings with Dick Schwartz, and the potential, I think, of internal family systems combined with psychedelics is really, there's a lot of potential there.
We just talked about that earlier. I didn't realize there. Yeah, that's pretty awesome.
Yeah.
I mean, okay, so you provide ketamine treatments for patients, for clients. But I want to talk to you a little bit about where you are in the MDMA studies. Like, where does that fit into who you are and what you can provide?
Yeah. So MDMA is in expanded access right now. It's not technically legal, so I don't work with that medicine yet. I'm trained in MDMA therapy. So that's where I'm at now. I'm waiting for it to be fully legalized. I think we're looking at 2023 for it to get through all of through all the studies. It's really wonderful. I mean, hopefully, in a couple of years, we're looking at psilocybin 2024. So, it'll be
interesting that MDMA is first.
Right? Yeah. I mean, I really tip my hat to Rick Doblin. He's just been such a champion of psychedelics, and he's been at it for so long. They've done it really, really wisely, how they have, they created this public benefit corporation. They're funding all of their own research, their own, studies and their own training program with private donations. They haven't received any money from the government. They've totally bootstrapped themselves. It's so expensive to, bring a drug to the market. I think they have a 5-year patent once it's legal to pay themselves back. They'll have the sole patent on MDMA, and then it's an open patent for anyone to replicate. So it's just remarkable what they've done. And it's a really beautiful medicine. It's not technically a psychedelic. It's more of an entactogen. Brings a really beautiful heart opening body high, feeling of connection. It's the research that they're doing is for PTSD in particular, and really creating what I see, how I think of it is creating a secure attachment to oneself, right? That we work with all these parts, and we have really disorganized attachment to ourselves when we have PTSD. You know, parts of us are stuck in the past in that trauma space. And so, I mean, I think all psychedelics open this space for us to recreate new attachment to those parts of ourselves that are young and lost and, you know, traumatized, to go back and reclaim them. Right.
Yeah. I recently had my first MDMA experience.
Nice.
And I just did it at home. And
disclaimer, not saying you guys should do that.
Yeah. I did it at home and I wasn't sure what to expect, but I talked for hours. I actually would not stop talking. But I talked a lot about my childhood, and I was able to talk about it to my fiance and process it, but not be triggered by it. And I remembered certain things that I didn't even know that I remembered. And I would talk about things and talk about abuse or how things made me feel. And I would talk and have tears streaming down my face, but I could keep talking. I wasn't getting too worked up about it. It was almost like I was talking about my little kid self, like a third person, like, oh, you know, that happened to me and that was really sad. Like I feel so bad for her, but you know, all of these experiences have shaped me to who I am and this healing journey that I'm on right now. So it was not at all what I expected, but it was incredibly beautiful.
It's amazing. So intuitively, you're basically doing IFS work, you know, with yourself. And I think when you do have trauma, it's so helpful to have a guide that knows the landscape of trauma, right?
Right.
I don't recommend that people who have extensive trauma do psychedelics on their own, because it can really pull up, you know. But my caveat is I believe that we should have access to our own consciousness and do what we want to our own consciousness. I don't think that it's the government's job to tell us what we can do with our own consciousness. So I want to throw that out there too. I don't think that anybody should be a gateway for you to, you know, experience yourself. But yeah, with internal family systems, it's really like what you're talking about, where, you know, we have these really young parts of us that are very vulnerable and exiled, that are stuck in the past. And then in front of those parts, we have protector parts, right? And some of our protector parts can be addicted parts that dissociate and do these intense things that really harm us, but they think they're helping us. They think they're helping us get away from that pain. Or we have other protectors that are hyper perfectionists, that are hyper achievers, right? That make everyone think that we're normal in the world and that we're functional, right?
Yeah.
And so when you get into these spaces where you can access those exiled parts, and those protectors are gently softened, right? Because they serve a beautiful role. We need our protectors to help us in the world, right? Props to the protectors. But when we can get into those vulnerable spaces and have compassion for how much we've gone through, it's so amazing. I think of it like time travel. Like when I've done that work with myself, it feels like I'm going in a little time machine, seeing myself, seeing all of the context of what was happening at that time in ways that I can never do when I'm fully, you know, not on psychedelics. And
that's how I felt. Yeah.
It's amazing. See that little girl and how vulnerable and, you know, how hard she was trying and how much she was suffering, and go back and be the guide that she needed at that time. I mean, I've had so many experiences in ketamine where I felt like I was going back to this part of me, and I was the angel that I had been waiting for when I was a 4-year-old, 5-year-old, right? I became that, and I was like coming back to myself. It's the most beautiful thing. And it feels like once you do that, it's like you're updating that really young part and saying, I'm not 5 years old, right? We're not 5 years old. I don't make my 5-year-old go out and, you know, be a therapist and face the person who's yelling at me on the freeway. I don't make that 5-year-old do that. I'm like, no, I got you, girl. I'm here with you. Right. Yeah. Good work. That's amazing. I love that you had that experience. Very healing.
Well, and it was very healing. And I think for my fiance I wouldn't talk about it for that prolonged of a time period because it would be too hard for me. Right. It would be very, very painful. So I think for him too, it made him have a better understanding of me and what I've what I've been through and how much progress I've really made and how much work I've done. So
one thing that I've kind of realized, and I think, you know, I've never done ketamine. I've said that before, but I've dabbled in a lot of other psychedelics. And I think a lot of people have fear around ketamine, even though it's legal, because they know that they're having to probably do some trauma work. And everyone's number one fear that I talk to who's hesitant is, I don't want to go through that again. I don't want to talk about it. I don't want to go there. But what I have found in these medicines is that it allows you to go there in a safe way. Yeah. And it's never, I'm not saying bad trips don't exist, because I know that they do. But I think when you're going in with an intention and with somebody who knows what they're doing, and especially, I can't even imagine what it would be like to have a therapist going into this, because we don't have access to that here in Kentucky. My psychiatrist is very into psychedelics, but he can't give them to you. So he was there to help us integrate, but it would have been really cool to have someone there in the moment. So I'm imagining that's what it's like for you when you're administering ketamine or doing ketamine therapy with someone. You're able to sit there with them and talk through some of these really hard moments that people think they can't get through.
Yeah, thank you. Ketamine's really an amazing, there's so much I want to talk about and address in what you just said. Ketamine's really an amazing medicine. As all of these medicines become legal and available, I'll probably primarily use ketamine for trauma treatment. It's really amazing. So ketamine is different than the classic psychedelics. The classic psychedelics work on the 5-HT2A receptors, right? Like LSD, mushrooms, ayahuasca, mescaline. So those are the serotonergic channels of the brain. Ketamine works on the kappa opioid receptors. So the way, and it works on the 5-HT2A receptors, but not exclusively. So ketamine is very soothing to the body. It's really different. It force shuts off the right amygdala. My understanding is that force shuts off the right amygdala. The right amygdala is like the smoke detector of the brain. So, you know, if there's a loud crash sound, your right amygdala lights up and says, okay, what is that? Is there a bear breaking through my door? Or is that a pan that just fell, right? And for people that do not have PTSD, that'll quickly quiet, right? You'll say, oh no, it's just a pan. But if you have if you have PTSD, and then particularly CPTSD, complex PTSD, early childhood trauma, that right amygdala lights up and it doesn't shut down. It's scanning the environment for danger all the time. I mean, everybody knows the story about veterans that can't tolerate the 4th of July fireworks because they think they're in battle. That's that right amygdala, right? That's like, what is wrong? So the thing that's amazing about ketamine is it shuts that down. There's a caveat that, you know, since I work with IFS, we talk a lot about getting consent from the protectors, right? If you just go in and just force shut down all of your protectors, you might have a backlash where the protectors are like, why did you strip me away from protecting myself? That's what happened when we were 5 and we were being molested. This is not okay, right? So you can without a good therapist that knows what's going on, you know, doing things where you're just blowing people's minds and giving them a bunch of, you know, psychedelics and thinking it's going to be okay, that's a problem, right? So with a good therapist, with proper preparation, with consent from all those protectors, you're doing ketamine and it kind of helps those protectors relax. It shuts down that smoke detector and you're able to have some detachment from the story. So it's like some psychedelics with guidance, but ketamine is the most predictable, I think, where you can go in and create that observer that's able to see what happened with separation, right? Ketamine is an amazing medicine. The other thing that's cool about ketamine is it's almost like a different medicine at different doses. So, you know, with mushrooms, with MDMA, you kind of know what you're going to get with doses, right? Ketamine, low dose, you can give someone a low dose, a psycholytic dose is what it's called, and you can talk to them the whole time and they're almost in a trance, and you can do this amazing work with them, right? Yeah, I do. I was originally trained as a depth psychotherapist in Jungian archetypal psychology, right? And doing dream work. This is awesome to be able to do dream work with low dose ketamine.
I want to do ketamine. I know.
It's awesome. So a higher dose, like a mid-range dose, your body's super relaxed, but your mind is lucid and you're journeying. So a lot of people say, oh, it felt like I was having an out-of-body experience, or I was dying and out of my body. Not in a bad way, because that right amygdala shut down, but like in this really lovely way of feeling like you're having a break from that normal hypervigilant mind. So it's not like psilocybin or ayahuasca where you have this body load thing. That's not happening with ketamine. And then, of course, at really high doses, we're looking at it as an anesthetic. You're getting your wisdom teeth out or whatever, right? You don't have any memory of it. But the thing that's challenging about ketamine is at higher doses, a lot of the content coming back is kind of like a dream where it slips away from you. It's not as accessible as like a psilocybin journey is, where you remember every single little thing that happened on your journey. You can go back and recall it. And so that's where a good therapist comes in too, is helping you kind of like recall what was relevant and what was important in your journey. But studies with ketamine show that it's not super important to remember all the content, that you still have benefit, brain, balance benefit afterward, right?
I was just going to say.
Oh, I was just, it really soothes. What I've observed with my patients is that it really soothes anxiety. That's the biggest thing, like particularly social anxiety. It's amazing. And you get benefit, days, weeks after a single treatment.
What I think is so interesting about this is ketamine therapy has been around a while. And I think psychedelic talk is just now coming up out of the woodworks. I know that even MAPS has been around since the 80s and research has been done since the 90s, but there's just this surge of information coming out and celebrities coming out and podcasts and documentaries. And it's all been within the past couple of years, although these are like medicines that have been around for thousands of years. And ketamine was something I had never heard of.
Yeah, me either.
And it's legal. And I think it's not crazy, but like, why do you think it is that it's not talked about more?
I don't know. It's kind of like the stepson, stepson that no one loves, right? And the second, it's weird. I went to the CPTR program at CIS in 2018, 2019. And we didn't even talk about ketamine when I was there. It was all about, psilocybin and MDMA. And I actually had a friend who was working at a ketamine clinic and happened to go. And then I met Phil Wolfson and started working with the Ketamine, Research Foundation. And it's funny. I don't know why. It may be because it's not as sexy as other psychedelics because it's been legal for so long and it's been an anesthetic. I don't know. But it's a truly amazing medicine. And I was just like you two. I'd heard that it was like a rave drug.
Special K.
Yeah. And so I had no desire. I mean, I was just like, ew, that sounds gross. And I had my first, I love that experiential component in trainings are there, because then you have the firsthand experience. And and my first experience was one of the most beautiful psychedelic journeys I'd ever had. And I was so impressed with it right out of the gate. I was like, this is amazing medicine. I could feel the change in me, and it was really inspiring. I would say that street ketamine can be dangerous, buying it illegally on the street because of the whole fentanyl issue that's happening. And same with MDMA and all kinds of things now, right? So I would say if you're going to go that route, definitely, get it from a legal source. But it's it's more and more available now. Another thing I want to talk about with ketamine is, and maybe you've talked about this on other podcasts, but there are different routes of administration of ketamine. So the thing that everybody knows about is Spravato, and it's this nasal spray, right? And the reason why there's more research, because Johnson & Johnson funded all this research, and it was a way for them to patent the ketamine. It's really expensive, but that's not the best way to administer ketamine at all. So you can do oral lozenge, which is really wonderful. And this is what places like Mind Bloom and New Life, and they're prescribing at-home use lozenges. you can get an intramuscular injection of ketamine, and that's what my providers give my patients, or intramuscular injection, or there's IV treatment. So there's a lot of different routes of administration with ketamine as well.
Yeah. Does dosage depend on the client and what they're struggling with? Okay.
Yeah, I think that as a provider, it's really important to have proper training and experience and in creating treatment protocols that are appropriate for each individual client, and to customize the treatment plan. I had a really, if I may share a story about,
yeah, please do,
dosing. It's so funny because I think in the psychedelic field, like so many things, are so dominated by this kind of masculine way of doing things, where it's like this idea that more is better. Like, let's give you more. If you have problems and you have a bad trip, you should take more. It's bigger dose. And I'm not that way at all with my clients. I think sometimes less is more. I had this client that was he had incredible complex PTSD, childhood of trauma, was a veteran. Diffused bombs was his job. So he saw awful stuff in war, had completely flat affect, just no emotion whatsoever. And he was getting these insane doses at this ketamine clinic he was going to, where they were prescribing these huge doses for oral ketamine that were just off the charts. And he would just kind of check out, right? And he was telling me this, and I was thinking, this guy likes to dissociate. This isn't helping him at all. This therapy, ketamine therapy, is not helping. It's just helping him push all that stuff down. And so I asked if we could do a low dose lozenge experience for him. And we'd been seeing each other for therapy for, 8 months by now. So we'd done a lot of work, had good rapport. We did a low dose ketamine session where I put him into a trance, and we talked the whole time, the psycholytic dose. We had this discussion, and I did internal family systems work with him. He went out into this field and he met this young part of himself, realized that he had been gay his whole life and had repressed this. He was, in his 30s. He was married to a woman. I mean, it was like this huge thing, and it was amazing. It was so beautiful to access this real part of him, and that had been covered up by all this trauma, right? Of all these years of trauma. And it was the most powerful psychedelic experience he'd ever had. And it was the lightest dose he'd ever had. Right. And there was a lot of integration and support that was required after that, of course, because that's such a big thing. And I have so much change. I have so much compassion for everything that he went through. He's a beautiful, beautiful human. But that speaks to, being a provider that's trained in trauma, because that was a very traumatic thing, right? He had no idea that was there consciously. If you were doing some underground ceremony and that came up and you had no training in trauma, how would you deal with that? How would he deal with that and digest that, right? It was really hard work. Wow. So, but yeah, I think that tracking where your client's at, what the medicine is they need, where they're at in their self-discovery process, there's a lot there. There's a lot there.
I want to ask you about consent and safety. Mm-hmm. And you were talking about having him in this like trance-like state. So we briefly talked about a podcast where we were hearing some like really horrible stories about psychedelics and in the underground and clinical settings, mm-hmm. where some people were being taken advantage of. And it was something like we've never experienced. So when we hear it, we're like, oh,
how could they do that? Because it's so sacred.
Yeah. But I can understand how when someone is on these medicines, they can be, you're in a very vulnerable situation. You're very malleable. You're talking parts of yourself that you've never told anybody before. How can you protect yourself against maybe being taken advantage of, or how to know who the right person to go to is?
Yeah, that's a big conversation, right? Yeah. I think when you, as a practitioner, when you have experienced psychedelics and you understand how vulnerable It is, right? And I'm not just talking physically vulnerable because you're like out somewhere else, but I mean, it's spiritually vulnerable. It's psychologically vulnerable. So having someone hold space for you they have to be impeccable with their ethics, with their boundaries, right? It's so important. I encourage everyone to be very careful who they allow to sit with them, to feel very safe with this person, right? There's a lot of talk about, like at MAPS, there's a lot of training around like what, you can hold hands, you can touch the shoulder, but that's it, right? Like in some of these podcasts, it was crazy seeing what people were doing, right? It's just unreal.
Yeah, like sexual
So
abuse.
I have explicit. Oh, it's crazy. And you can imagine that people that are narcissistic see this opening of, this person can't defend themselves, right? And so I think one thing we need to dispel is this Pollyanna idea that all psychedelics are wonderful and they'll always heal everybody. And if someone is just on ayahuasca, they're going to be heart-centered and compassionate and they're a safe person. No. People can do a ton of ayahuasca and it can only exacerbate their narcissism. It's not a given, right? So I think that's an important thing to talk about. Really seeing how much I just wrote a post literally yesterday about this.
I saw it.
Did you?
I want to see it. I want to know.
We just talked about it.
Oh, we did.
If you are going to be serving any kind of psychedelic medicine, you need to do your own work, right? That's a catchphrase. But that means being able to be humble in realizing you don't know everything. You need to have had your own therapy, right? Work through your own trauma so that you're not trying to work your trauma out on someone else. There's this thing in psychology called transference and countertransference. This idea is that your patients will transfer onto you that you're their mother, brother, sister, girlfriend, boyfriend, whatever, and that therapists will counter-transfer their stuff onto their patients. Everybody has it. It's really important that you're conscious of what's happening. Oh, this person is bringing up this thing in me, right? I'm attracted to this person. Okay, then I need to refer this person to someone else because this is not good for me to be a therapist for this person, right? So when it's such a nuanced, qualitative conversation. It's not quantitative. Just because someone's been through the MAPS training doesn't mean they're a great person. I mean, look at Cover Story and what they talked about.
That's what we were talking about.
Yeah.
So, really like doing your research about the qualifications of this person, but also how do you feel about them when you're in their presence? Do they feel like they're respectful of you? Do you feel safe? And sometimes when we have trauma, it's hard to discern that, right?
Yeah.
We bond to people that are not appropriate.
Yeah.
I think you're exactly right.
So no one should be touching you. The only thing I do is hold my client's hand. If they reach out and we have a conversation about it before, if you reach out, I'll hold your hand. I talk explicitly about consent with my patients. I tell them, I'm not going to sit really close to you. I'm not going to touch you. I think it's really important to be explicit about those conversations, right? Having another therapist or your medical provider in the room for you. So you have two people that are making sure that it's safe. I mean, these kinds of things are really, really important. I encourage practitioners to get a lot of training, to be specifically trained in trauma. That's very important, right? Because that can come up and people can not know that they have trauma. That feels important. And to always have supervision or consultation, right? That you're always talking to other practitioners and talking about your cases, talking about what's coming up for you. But yeah, I stay up at night worrying about these sorts of things with the explosion of interests and people, like, come train at our weekend workshop and you'll be certified to be a psychedelic therapist. It takes a little bit more, Takes a little bit more.
Are all therapists trauma informed? Because I feel like they're not.
No.
Okay.
Absolutely not.
Yeah.
Absolutely not. Absolutely not. In fact, I was just having this conversation in a consultation group that I was in, that we were all saying, wow, we didn't even feel like we were ready to treat trauma when we had a master's degree and internships, right? I mean, I have specific training. I have years of training in trauma. Like I'm certified in EMDR. I'm trained in IFS. You know, I have specific training, postgraduate, post licensing in trauma, years of trauma training. So, you know, therapists aren't all trauma informed. And in all the years that I've been practicing, I've never been asked by a client what my license is. That concerns me. We're not educating people about what to ask for when you're interviewing a therapist, right?
Interesting.
Yeah, I mean, of course, people could search in my licensing record and make sure that I'm licensed, but it's really important that we're informed consumers, right? That when you're looking for a therapist, that you're looking at what their qualifications are, that you're looking up their license to make sure that they've had the proper training, right? It's really, really important. You're opening yourself up and being really vulnerable with someone, and you want to make sure that you feel safe and contained, right?
Yeah. I think that there's a misconception there because it's, you go to a doctor and you automatically trust everything that they have to tell you, and you're going to believe them instead of maybe trusting your own intuition or, finding other expert opinions. Same thing with the therapist. It wasn't until after I did mushrooms where I found a psychiatrist who did psychedelic integration. But beforehand, I just went to a therapist. I didn't know anything about what they were specialized in. And there were some therapists who probably didn't have the right expertise for the trauma that I had been through.
Yeah. And you can ask directly, have you treated this kind of trauma before? Are you trained? Who trained you?
But I think that we're a little wired that you guys know everything.
We kind of are.
Mm-hmm.
Absolutely. Yeah.
Even
so much part of our culture, right? Where it's like you turn over your sovereignty to a physician or a therapist. And it's really, really important that you check in with yourself, right? Yeah. My first appointment with any new patient, I say, please, let's not just sign you up for a bunch of therapy sessions. Go home, feel into it, see if you like my style. See if I resonate with you and that you feel aligned with me, because I don't want you to feel like you have to sign up for a bunch of therapy sessions because you came to this first one. So important, right?
There is something that I see a lot in psychotherapy or psychedelic assisted therapy where you guys, whenever you go through these trainings, you practice with this medicine on yourselves. And that used to be common practice with doctors in like the 1940s and 50s. Like in order to prescribe a medicine, they had to take it first and see how they felt. And that's a lost practice. That is not a thing that they do anymore. They're just passing out pills. They've never taken them. They don't know what they do. And I think that that's important.
Giving them to kids, not knowing the effects that it will have on children.
Exactly. So, there is this, I think this is my personal opinion, but going to someone who has had these experiences themselves would be so much more of a comfort to me than, my therapist at the time, the first time I had done mushrooms, had never heard of this stuff. So it was very hard to talk to her after that. And I still love her. She's a sweet person, but I haven't seen her in a very long time. I switched to a psychiatrist who knew, because it was very hard to talk to her about any of the things that I experienced, and have that understanding. So I think that that's important to go to someone who knows what they're talking about, who knows how to work with these things. And the trauma informed, I'm just now realizing that I was missing a big part of looking for someone in therapy. I didn't realize, like what she was saying, I thought all therapists were trauma informed. I thought that that was their job. I thought that that was part of what they do, but just like I thought that's what doctors were supposed to do. I have someone who started going to therapy last fall for depression, anxiety, insomnia, losing hair. And it's a side story that I won't get into, but she went to a trauma-informed psychiatrist, holistic psychiatrist, and after a few times she stopped going. And we were questioning why she stopped, and she was like, well, he said none of those things were related to trauma. And I was fine. And my immediate, I'm like, A, you're either lying, which I think that that's what it was, and she just didn't want to do the work, or B, that person needs to lose their license. Because I'm not trauma informed. I am, but like not in a professional setting. But I can sit here and tell you right now that every single one of those things are probably due to trauma. It was just mind blowing to me, the misconceptions and misunderstandings.
Yeah, I did a training. I won't name the entity, but I did a training where they didn't feel like the therapist needed to have psychedelic experience in order to give them to other people. And I deeply disagree with that, right? And their explanation was, well, if you were prescribing blood pressure medicine, you don't need to take the blood pressure medicine to know it works. And even that statement is problematic, right? Because you're pathologizing the medicine. These medicines are completely different than anything else. You, as a practitioner, in my opinion, in many people's opinion, a good training program requires you to have an experiential component so that you understand what these medicines do. At my retreats, every time inevitably, I have a psychiatrist come to my ketamine retreat and say, this is where my clients have been going. I've been prescribing ketamine for years, and I had no idea that this is where they went. And I've had a couple of them say, I don't feel like I'm adequate to be able to prescribe this anymore. Like I shouldn't be doing this until I have more experience.
That's good for them that they have awareness.
Yes, it's imperative. Totally. It's imperative that you understand, because if you don't know what those medicines are doing, psychedelics are doing, you don't have a deep trust. So if your client starts freaking out, if you've been in that space a bunch of times, and you know what a bad trip is like and what it looks like when they're coming back out, you're able to hold space in a way where you're not agitated. You don't have this countertransference of your own distrust of this medicine, right? So to your point, Leah, I would never have anyone sit for me that hadn't had at least 10 journeys with that medicine. No way. And I think if you're an ethical provider, you would not be rushing to get into this space and giving out this medicine if you had no idea what you were doing and you hadn't done your own work, right?
Well, yeah, and it's so interesting because with SSRIs, I know so many people who go to the doctor and they're like, I'm really struggling, not sleeping, I'm feeling really sad or down or struggling to get out of bed. And they're like, great, here you go. And giving it to teenagers. And there's not a question of, are you going to any therapy? Are you getting adequate sleep? What is your stress like? They don't have that mental health training, but then they give something for someone's mental health. And I just don't understand that. But it's just so normal. Mm-hmm. So.
Yeah. Well, I don't think I don't think doctors are malevolent or trying to have a quick fix.
Right.
They're trained this way, where our Western medical model is you isolate something down, you have a specialty, you just treat this one thing, you don't look at anything else outside of that, and there's a magical pill that'll save the day. And all of their training is about that. This holistic idea is not part of the training. I've heard that I doubt it's still the case. It's probably very westernized now, but in China, the town's medical provider would be paid if the patient was healthy. That's how they got paid. If everybody's healthy, they got paid. If people were sick, you don't get paid.
Doctors wouldn't be making very much money here.
Right? Yeah. And so, think about how different that model would be, right? Yeah. And so, I think that I know I said this early on in our talk, but we need to pull the lens back and really look at, these foundational ideas about health, mental health, medicine, something that's really revolutionary about this new phase of psychedelic medicine. Psychedelic medicine's been around, since the 50s, right? This has been around for a long, even before then with indigenous cultures, of course, but like research, right? But something that's really miraculous is we're looking at a medicine where it's not just the medicine, but therapy combined with it. This is part of the FDA protocol that MAPS is doing. This is really amazing. This is a totally new thing. You've got therapy combined with a drug. This hasn't happened before like that, right? And so I feel like that's really opening a whole new space for thinking about mental health in a new way that's beyond psychedelics. It's pretty incredible, you know?
I think so too.
So, yeah.
I have a friend who is in LA who did ketamine therapy, but it was during COVID. There was nothing in person going on. And it was like sent to them. I think it was a lozenge. And they were talking with their practitioner through Zoom or Skype or something like that. Is that a service that you provide, or do you prefer the in-person?
In person, yeah. But there are places like Mind Bloom and New Life that are prescribing virtual. During COVID, we all had to get really creative with helping people.
Yeah,
right?
sure. Yeah.
I mean, it was, yeah, which is really beautiful, you know, that we were able to adapt to the situation. But yeah, I mean, in person, there's so much more than just the visual, right? And the auditory. I mean, breathing with a person. I mean, there's a lot of times where my client's having a bad trip and I'm deep breathing with them and they can feel that. They might not even hear it, but that energy helps them soothe their nervous system. So I feel like I have a more expansive tool set if I'm in person, right?
Yeah.
I would
but yeah, there is that. Yeah, I mean, I think that option is available for people.
And you also host retreats. Are your retreats just in Costa Rica, or are they in the US too?
Nope. Yeah, I have retreats in Utah. I do a retreat in the mountains once a month. That's a day-long group retreat. And there's this whole other alchemy that happens when we do group process together, right? Like when you do psychedelic solo or with your provider, that's one thing. When you're processing in a group, there's so much magic that happens with that. So I really love that modality. And then, you know, if you expand a retreat out, like at the trainings I do at the Ketamine Training Center, we're training practitioners, but we have an experiential component and we're together for a week, you know, at places like Menla in New York or 1440 in Santa Cruz. And that experience of having the ketamine experience and then being together all week and talking about it and in vivo and taking people to do, you know, an IFS session or an EMDR session when they're constellated. There's something really beautiful, I think, about a group process like that. So I really love that.
I want to go on one of our retreats.
I know. We live in the wrong part of the US.
Yeah, we do. So I never even asked you, just to backtrack, how did you get into the psychedelic medicine space? Like, how did that journey even start?
You know, I was a psychonaut teenager, you know, decades ago. So I knew that there was amazing potential in that. And, you know, it's so funny. I hosted an event at Sundance Film Festival in Park City that was premiering this documentary called Entheogen. I think it was what it's called, Entheogen. And it was, you know, we had like Off to the Side and we had Ralph Metzner and Daniel Pinchbeck come and, you know, Andrew Jones came and painted live and we had Bass Nectar play. I mean, it was like back in the day, you know, in like 2006.
So cool.
You know? And I never, ever thought that that was going to be something that I was going to be doing in my clinical practice. Or it's really amazing to see this happening right now. And, you know, but the potential, I knew the potential was there back when I was, you know, 20 years old. It helped me so much. So, yeah, it's really exciting.
That's crazy.
I know, to see how far it's come since then. And I can't even imagine how far it's going to go and how quickly it's going to happen now that it's becoming so.
Well, I mean, tell these guys like, you know, Bill Richards and my mentor, Phil Wolfson, who are, you know, in their almost 80 and they've been banging the drum for psychedelics for decades and decades. And they never thought it was going to be like this. Like for them, it has not been a fast process. You know?
Oh gosh, I can't even imagine.
I went to Sasha Shulgin's lab, the guy who synthesized MDMA, right, back in the day, and his wife, and Anne Shulgin just passed away last month, but got to meet her back in 2019 at their farm, and she was talking about those years of prohibition and how terrified everybody was, and it was all, underground, and I mean, a lot of people have worked very, very hard to get us here. Maria Sabina, the beautiful grandmother of psilocybin mushrooms in Mexico, she was shunned by her entire community for sharing the medicine. I mean, it's been a long haul for many people. And I have so much gratitude for how people have laid that foundation for me to be able to be talking with you openly about this right now. It's really wonderful.
And legally.
Yeah.
Yeah, I love that.
Yeah, it's amazing. Yeah, it's amazing.
It's beautiful where it's going. I just see so much growth and hope and potential and all positive.
Yeah.
Try not to focus on the negative.
Speaking of potential, I'm obsessed. This is off topic. I am obsessed with Real Housewives of Salt Lake City. And you probably should do some ketamine treatments with some of them too.
I'm not a TV person, but I can already imagine what that is all about. It's really actually fascinating to be in Salt Lake City. There's a real naivete about psychedelics here, so it kind of is nice because it's like a blank slate. And my specialty is sexual trauma, and Utah is one of I think it is the largest per capita cases of reported sexual trauma in the country. So there's a lot going on here. A lot of shadow.
It's big Mormon country.
I never thought about that.
Yeah.
Oh gosh.
Yeah. So most of my clients are women.
Yeah.
And, and it's interesting because I'm really a feminist, and I'm, for female sovereignty of our own bodies and minds and consciousness. And so it's interesting to work here, to say the least.
I think you're right where you need to be.
Yeah.
Honestly, much purpose there. If you can just give our clients some information to find you, or even to follow you on Instagram, even if they're not near Salt Lake City. I think we probably have some listeners out there. So how can they come and how can they find you? How can they be in touch?
Yeah. So Sunny Strasburg Therapy is my website. And do you want me to spell it, or are you going to have it in the notes or something?
Yeah, we'll link it.
Yeah.
Okay, got it. Okay. So sunnystrasburgtherapy.com. I have sunnystrasburgretreats.com. And my Instagram is Sunny Strasburg LMFT. So follow me there. I try to stay up on it. I'm on LinkedIn too and Facebook, but
so much to keep up with.
I know. And we're going to be looking into your retreats.
Absolutely.
Great. Yeah. Please consider. They're fun. I love working with retreats and the group experience.
Yeah.
It's my new favorite.
I like the community aspect of it.
Absolutely.
Totally.
Thank you so much for sharing today and for giving us some information that is just like all of it's mind blowing. It always is. I'm never shocked, and I am and I'm not. I'm like, how am I still learning? This is crazy. It's such a big world and such a big space to learn in. So we appreciate the work that you're doing. Seriously.
Thank you. I appreciate being here.
And we will talk to you guys on the other side.
Bye.